Welcome, everyone. I'm so glad you could join us. It's my favorite thing at the beginning of every webinar. I know I say it, but I love watching the names pop up. I see lots of familiar names, see new names. It's always really exciting. We'll give it just a minute for everybody to come in. I don't know where you guys are in the world. I am outside of Houston, Texas, and it is unseasonably warm. They're having excessive heat warnings. They're saying it's going to feel like 113 today. So you're going to see me with lots of little hydration breaks because it is warm. I know it's unseasonably warm in lots of places. So hopefully you guys are staying cool. Give it just a second and seeing people still trickling in. We're going to actually, if you have a moment, post in the chat. We have a survey just about our webinars that we do, wanting feedback from you. We do these to help you with your coaching practice and help you level up. And we would love to hear from you on what makes that time valuable. So we'll drop that in the chat here in a minute. If you wouldn't mind taking just a quick moment. It's 6 very, very short questions. Just answering those for us, we would be very appreciative. That would be amazing. Oh. Thank you, Rebecca. I appreciate you posting that too. If you guys don't mind just taking a moment with that link at some point, we would be most appreciative. So let's dive right in because as always, we have a lot to cover in this hour. And we're talking about men and how to support them through their health and wellness journeys. Lots of good stuff. So if we haven't met yet, my name is Ashley Honeycutt. I am the Director of Health Coaching Operations here at YourCoach Health, as well as a board-certified health and wellness coach. And for those of you that we haven't met yet, it's also my pleasure to introduce you to YourCoach. We are a HIPAA-compliant platform that is tailor-made for health and wellness coaches by a health and wellness coach. Our platform is designed to give you everything you need to run your practice smoothly, from HIPAA-compliant chat and video sessions to session notes, comprehensive library of resources, plus contracting opportunities with us for coaching with our industry partners for our verified and validated coaches. What makes YourCoach truly unique is that we are the only operating system for behavior change that is powered by health and wellness coaches. We're partnering with organizations across various industries to bring health coaching to their clients, members, and talent by powering up their health coaching offering with our tech-enabled, verified, and validated health coaches who initially practice on the YourCoach platform. At YourCoach, our mission is to create a world where every individual has access to a health coach by 2030. We know the power of health coaching, and we want to help create more happy and healthy humans. It's what we're all here for, right? And let's get started at the heart of today's topic. Men's health issues are often less discussed, but they're quickly becoming more pronounced. We're seeing a rise in physical, mental, and behavioral health issues among men that includes things like higher rates of chronic disease, shorter life expectancy, and limited engagement with healthcare services due to things like financial barriers, stereotypes, and the social stigma. What's truly exciting is that there's a ton of studies out there that have revealed that men find health coaching more appealing than other forms of support, such as psychotherapy. And this opens up a world of possibilities for health coaching interventions among men. With their personalized guidance and unwavering support that we can offer as coaches, health coaches can empower men to achieve their health goals and establish habits that lead to long-term well-being. So while going through all of these research studies, I was surprised to learn that men in the United States have the highest rate of preventable deaths among high-income countries. That shocked me, and it's really sad. It's a wake-up call that it demands action. And that's why, in honor of National Men's Health Month, which is this month, we're diving deep into the pressing health challenges faced by men and exploring how we as health coaches can step in and step up to help prevent and overcome their health challenges. So I'm really excited to have you guys here as we dive into it, because we know this is something that affects the lives of our fathers, our husbands, our brothers, and sons everywhere. Men's health is a silent crisis that's been in the shadows for too long. So we're going to bring it into the light and talk about it today. So did you know that across every stage of life, from infancy to old age, men have a higher risk of death compared to women? This disparity not only impacts men themselves, but of course it has a ripple effect on our families and our communities. In the United States, there's also a growing longevity gap between men and women, and the statistics are concerning. So according to data from 2021, women have an average life expectancy of 79.1 years, while men lag behind at 73.2 years. So this creates a staggering difference of 5.9 years, and it represents the widest gap seen in a century. As if that wasn't sad enough, not only are men dying at a younger age than women, they are also more burdened by illness during life. They fall ill at a younger age, and they have more chronic illnesses than women. Now, it's important, I'm going to pause here for a moment because it's important to note that this data, it does not account for differences among non-binary and trans individuals who certainly face unique challenges and barriers in accessing quality healthcare. They can run into challenges with stigmatization, discrimination, a lack of understanding from healthcare providers. And trans men experience unique health disparities, including higher rates of mental health concerns. They have a 2.5 times increased risk for heart attack or stroke than cisgender men. And trans masculine and non-binary people have the highest predicted average number of chronic conditions compared with all other gender groups. So this is definitely a topic that could have a much longer conversation, but we would be remiss if we didn't include this as part of our men's health, because this is certainly a challenge in the healthcare community. So now, to go back and understand the reasons between that longevity gap between men and women, it's helpful to examine the health behaviors and attitudes of men compared to women. So on average, men tend to pay less attention to their health, which can have detrimental effects. Men are more likely than women to smoke tobacco and consume alcohol, to make unhealthy or risky choices, and to put off regular health checkups or medical care. Funny enough, as a matter of fact, a survey from the Cleveland Clinic said that 72% of men would rather complete household chores than to see their primary care doctor. I was shocked when I read this. And so first thing I went running to my husband, and I, of course, asked him this question. He was like, oh yeah, I would much rather vacuum the house than go to the doctor. So it still just is crazy to me. But it's a 72%. That's a significant percentage. I mean, we're talking 3 out of 4 almost. So these behaviors can put their well-being at greater risk and contribute to the disparity in life expectancy. We can also attribute some of that health disparity to cultural biases around masculinity. Societal norms often promote the idea that men should hide their emotions, they should tough it out, and they should avoid seeking help. This can lead to a reluctance among men to express their vulnerabilities or discuss their health concerns, which ultimately impacts their overall well-being. So we've got lots of different issues that we can address, and it's vital for us to break down those barriers that discourage men from prioritizing their health. We have the old adage about men tend to adopt that suck it up mentality where they dismiss early warning signs of declining health. And they may experience things like digestive issues, weight gain, or high blood pressure, and they'll put them off to the side and say like, oh, it's not that bad, or, oh, I just need to man up or suck it up and I'll move past it and it'll go away. They delay addressing those concerns until it's too late, or they can no longer manage them independently. Now, this is a lot of information on this chart. And when we consider that longevity gap, we also need to have an understanding of the health challenges facing men at different stages of their life. So we've kind of talked about some of those societal norms, we've talked about some lifestyle and some choices, and now we're moving into that more clinical space. So when we delve into all those factors influencing men's health behaviors, we can uncover some of these striking insights that are in this chart. We know that fear of diagnoses is a significant barrier, and it prevents men from seeking medical care. Approximately 21% of men admit to avoiding doctors because they feel nervous about potential health issues. Societal expectations and stereotypes play a role, and seeking healthcare is often perceived as a sign of weakness, conflicting with traditional masculine norms. As a result, like we talked about, men downplay or ignore those health concerns, hoping they will simply resolve on their own. Of course, the thing we all know, spoiler alert, they don't go away on their own. To understand the gravity of men's health challenges, it's important to examine the leading causes of death among men across different age groups. This graph depicts the leading cause of death for men in the United States, and it can offer us some valuable insights into the health issues affecting men, depending on what stage of life they're in. So overall, heart disease, cancer, and unintentional injuries top the list. Promoting proactive health measures is crucial, as is educating men about lifestyle factors that can prevent conditions like heart disease and diabetes. Encouraging regular checkups and screenings can also contribute to early detection and effective treatments. Now, another thing that's not in our top 3 and is often overlooked, but is a really critical aspect of men's mental health is their overall health is mental health. While it's not in the top 3 concerns, that high suicide rate among men definitely demands attention and action. If you were at our webinar back in May, you remember we talked about some really great tips for mental health and for coaching around mental health. Definitely check that out. It's on our YouTube channel. Lots of good little nuggets in there, but definitely something worth mentioning. So let's talk about some common lifestyle factors that affect men's health. First up is smoking. It's the riskiest of all health habits, and according to the World Health Organization data from 2016, the global prevalence of tobacco smoking among males was around 34.4%, while the prevalence among females was approximately 6.1%. That makes men almost 6 times more likely to engage in smoking. Also, in most cases, women eat a healthier diet than men. In a Massachusetts survey, for example, women were about 50% more likely than men to meet the goal of eating at least 5 servings of fruit and vegetables a day. That masculine ideal of a large plate of meat and potatoes can be challenging to men's health. And I know we're throwing a lot of stereotypes in there about men with meat and potatoes and with these masculine norms. But studies have shown that it is rooted in a little bit of reality when it comes to men's health. Also, stress. Prolonged or chronic stress can contribute to the development or even the exacerbation of mental health conditions. So things like anxiety disorders, depression, increase the risk of heart disease and cardiovascular problems. They can weaken the immune system, disrupt digestive processes, and disrupt sleep. And of course, drinking. Studies show males dominate in self-destructive habits such as excessive drinking and are about 1.5 times more likely to engage in excessive drinking than females. We've touched on this a little bit, but stigma and cultural expectations. According to a major survey conducted by the Commonwealth Fund, 3 times as many men as women had not seen a doctor in the previous year, and more than half of all men had not had a physical exam or a cholesterol test in the previous year. Then we have accountability and support. Having strong interpersonal relationships and a support network can play a significant role in mitigating various problems, things all the way from like the common cold to more severe conditions like heart attacks and strokes. On the other hand, we know that social isolation has been recognized as a risk factor for heart disease. And work-life balance, something that is getting a lot of attention lately for good reason. The image of the stressed out, workaholic male executive isn't just a stereotype. It's got a basis in reality as well. The pressures of work can significantly increase the risk of serious health issues, things like hypertension, heart attacks, strokes. In fact, in Japan, karoshi, or death from overwork, is a recognized medical condition that even entitles survivors to compensation. Personality traits like type A behavior, stress, even sometimes hostility or anger have all been linked to an increased risk of heart disease, and these traits tend to be more prevalent in men than in women. It's a complex interplay between work-related stress and personality factors that may make men more vulnerable to health concerns. There's an entire slide we could do on common health coaching topics for men, and it would be so difficult to cover all of them. So we're going to group them into 3 main buckets for today. Heart health is a big one. So we know that heart disease is So again, there are lots of things men may come in to coach on. We don't want to say that this is all they'll ever want to coach on, but these are common ones and ones that can be challenging and also really impactful to coach around. So let's start with heart health. The American Heart Association highlights that 1 in 3 men experience some form of cardiovascular disease. Each year, an estimated 2.8 million men suffer from strokes, hypertension, and it's increasingly prevalent among younger men. However, it's really important to note here that heart disease is largely preventable by adopting positive lifestyle choices. As health coaches, we know this. And we also know that heart disease can sometimes manifest slowly and silently without any apparent symptoms until a man experiences the signs of a heart attack, heart failure, or arrhythmia. When these events occur, symptoms can include things like chest pain, discomfort in their chest, upper back or neck pain, indigestion, heartburn, nausea or vomiting, extreme fatigue, upper body discomfort, dizziness, shortness of breath, palpitations, that's those little flutterings in your chest, or swelling of the feet, ankles, legs, abdomen, or neck veins. There's a lot of risk factors for heart disease as well. A major one is diabetes. Health experts have estimated that slightly over 1/3 of men fall into the pre-diabetic category. It's crucial to address prediabetes, as we know it can progress into diabetes, which is a well-known risk factor for heart disease. By effectively managing blood sugar levels and seeking appropriate treatment, the risk of heart-related complications can be minimized. Other risk factors include things like physical inactivity, an unhealthy diet, excessive alcohol use. Side note, 1 in 5 men will develop alcohol dependence during their lives. So that is no small number. We're talking 20%. Also, being overweight or obese, excess body weight puts additional stress on the heart, it raises the blood pressure, it disrupts the balance of cholesterol and triglyceride levels in the blood, all of which, of course, contribute to heart-related complications. As a side note, we also did a webinar back in February strictly on heart health. So if you want more information and a deeper dive into heart health, be sure to check that out on the YouTube channel. It's an entire hour devoted to heart health specifically. It's pretty cool. What coaching tools are effective for men who want to improve their heart health? First is education. Remember how we talked about how men don't visit the doctor as often? Here's a great place to utilize and leverage resources from the American Heart Association, the Centers for Disease Control, the National Lung, Blood, and Heart Institute, or Million Hearts. Increasing their knowledge allows men to be empowered to take control of their health. Also, symptoms or medication trackers, encouraging clients to work with their healthcare provider to manage any medication prescribed to control their biometrics like their blood pressure and improve cardiovascular health. Help them to develop systems and strategies to support their success in taking their medication. We know all about habit bundling. We know about making things obvious, putting the medication out where they can see it. We can offer a lot of ideas and help them come up with that solution that's going to work for them as a reminder to take their medication. Now, remember, even if you do know about these medications, or perhaps you've even taken these medications yourself or a loved one has, stay in scope. Refer them to their healthcare provider for advice. We don't want to give any advice around medication. We don't want to tell them when to take it, how much to take, if they need to wean off of it. We don't want to touch any of that. That would be outside of our scope. So we want to refer them to the healthcare provider for advice. We can, however, take that advice that their healthcare provider has given them and help them figure out how to make it work in their lives. Also, super fun announcement on this one. It is hot off the press just today, so I'm super excited to share it. We announced a partnership with MediSafe, which is the leading digital health company specializing in patient engagement and medication management. And we're going to take MediSafe's current and future customers. They're going to have the opportunity to augment their patient support programs by leveraging our validated and verified health coaches from our platform to assist in better patient outcomes. So super excited about this one. We didn't know when we put this together, we were going to be able to share it alongside of this little tidbit about symptom or medication tracker, but I'm so excited about it. I just can't help it. We're going to throw it in there. Also, you can help your clients prepare for a doctor's visit. So we know that as a whole, men are more likely to put off those regular doctor's visits. And when meeting with the doctor, 1 in 5 men is completely honest about their health. This omission of information can arise out of embarrassment, not wanting to hear that they need to change, or they were simply not ready to face a particular health concern. So one way that we as coaches can provide meaningful support for men is in those weeks prior to the doctor's visit. We know visiting a doctor can be an intimidating event, and connecting with the coach before the visit creates space for your client to share their thoughts, their concerns, their needs, and potentially craft a plan of action for the upcoming visit. The plan could include getting clear on the expectations about the visit, maybe having questions ready for their doctor, and those preparatory steps can help men feel more confident when walking into the clinic or the hospital. We can also use decisional balance, which is a great tool to help clients explore the advantages and disadvantages of making the desired behavior change. It can help them develop strategies to overcome any obstacles or challenges that arise, and it allows them to consider the potential consequences and impacts of each option, enabling them to make choices aligned with their goals and their values. Now, we know the impact of SMART goals on behavior change, but men particularly seem to resonate with being task-oriented, and this can bring a sense of urgency and strategy to their health plan. And men may encounter difficulties in expressing and articulating their emotions due to those societal norms, or they may have trouble talking about challenges with other men. And this is where we can really play a valuable role in supporting men in developing emotional intelligence and communication skills. By encouraging that healthy emotional expression and validating their experiences, coaches can cultivate that environment of trust and openness. Let's take a look at a case study. Here's John. John is a 55-year-old man who was diagnosed with heart disease 6 months ago. He had a heart attack and he underwent an angioplasty to address a blocked coronary artery. John is married with 2 teenage children and works a demanding job in the corporate sector. He has a family history of heart disease and acknowledges that his sedentary lifestyle, poor eating habits, and chronic stress contributed to his health condition. However, he does not see a way to change this. There's a lot of different ways we could approach this. And of course, a conversation with John would help us figure out what's going to be most impactful for him. But speaking in generalities, of course, just reading this little blurb, as a coach, I would be really curious about his lack of belief in his ability to make positive changes. So exploring his perceived barriers, helping him find ways to see that change is possible with the right support and strategies. And we could even tap into his success in his corporate job and find out what strategies helped him be most successful there, and then pull a lot of those over into that health arena. Secondly, his sedentary lifestyle and his poor eating habits are significant factors that contributed to his heart disease, and he's already had surgery on them, so they're getting pretty advanced and serious. I would want to ask about any doctor's orders or follow-up care that maybe that doctor has prescribed. Also, we know that his chronic stress from his demanding job could further exacerbate his heart condition, so working on stress management techniques could also be an important aspect to tackle. For John, goal setting could be really impactful. We know that goal setting works for a lot of our clients, but particularly here, I think this could be a really dynamic way. It can sound really obvious, but helping John set small, easily achievable, of course, realistic goals, we can break down that larger lifestyle change into manageable steps and make it feel more attainable. So this approach could empower him and provide a sense of progress and accomplishment. We can even use decisional balance here to weigh the pros and cons of the change, or maybe pull in the wheel of life to tie those choices into his values. We could ask open-ended questions to encourage reflection and self-discovery. So things like, what do you think would be the biggest challenge in making changes to your lifestyle? Let's get right to it. Like, tell me, what are those barriers? What are those reasons why you don't see a way to change this? This allows him to express his concerns and his fears. And then, of course, we could respond with empathy and understanding. I think it's really important here to remember that any step forward is progress, no matter how small it is. Even if John is in the pre-contemplation phase and we move the needle just a little bit into contemplation, that's progress. And that's something that we can celebrate. I know as coaches, sometimes we want to get right to that goal and we really want to see that progress, then checking things off. But sometimes just moving that needle through the stages of change can be a really big deal for the client. Quick water break. All right, let's move into mental health. The World Health Organization states that mental health is more than just the absence of mental disorders or disabilities. Caring about mental health is not only about managing current and ongoing conditions, but also looking at long-term wellness and happiness. Now, again, we covered a lot of this in our mental health webinar back in May, but it's worth revisiting as men die by suicide nearly 4 times more often than men. Often mental health disorders and substance use disorders concurrently occur because some people struggling with a mental illness will use substances to self-medicate, and substance abuse can sharply increase or even trigger new symptoms related to a mental health disorder. Men are also more likely to engage in patterns of behavior such as aggression or anger, which can also impact men's mental health in their relationships, and addressing these patterns through therapy or support groups or even anger management techniques could be helpful. Emotional expression and communication also tends to be a challenge for some men due to societal expectations around masculinity. Encouraging that healthy emotional expression and effective communication skills can help men build stronger connections and seek support when it's needed. We've already touched some on that intersection of masculinity and mental health, but it's worth emphasizing again that that stigma is very real and it does affect men's access to healthcare. And finally, coping mechanisms and risky behavior are also worth considering, as men may resort to unhealthy coping strategies or engage in risk-taking behaviors as a way to deal with their emotional struggles. Now, we talked a little bit about patterns of behavior in that previous slide, but we may not be as familiar with it. So I want to pause here for just a second to dive in deeper, because they do play a significant role in men's health and in the way coaches interact with male clients. So traditional gender norms and societal expectations often shape behaviors in men and women, right? These behaviors can include, for men, things like stoicism, emotional suppression, or the tendency to resort to aggression or anger as a means of expressing themselves. Men may feel pressured to conform to these patterns, which can have negative implications for their mental and emotional well-being. It's important to address and challenge these patterns to promote healthier behaviors and emotional expression. So men may face challenges in identifying, understanding, and effectively managing their emotions due to those societal expectations. And they feel that discouragement for vulnerability or for emotional expression. Promoting emotional regulation skills can help men navigate their emotions in a healthier way, which then leads to improved mental health outcomes. So teaching techniques such as mindfulness, breathing exercises, and cognitive reframing can empower men to regulate their emotions and enhance their overall well-being. Traditional masculine norms also unfortunately downplay the importance of empathy, which results in difficulties for men in understanding and connecting with others on an emotional level. Encouraging empathy can foster better relationships, better communication, and support networks for men. By highlighting the benefits of empathy and then providing opportunities for practicing empathy building skills, men can enhance their emotional intelligence and strengthen their social connections. Also, unhealthy expressions of anger or aggression can lead to destructive behavior, strained relationships, and negative health consequences. So it's really helpful and important to help men explore and develop healthcare strategies for managing their anger, such as assertive communication, conflict resolution techniques, and stress management strategies. By providing tools and support to address anger and aggression, men can cultivate healthier coping mechanisms and improve their overall well-being. So remember, throughout this, not only are we improving mental health by helping them with that emotional regulation, we're also helping their relationships. And we know that loneliness is a key indicator and risk factor for heart disease. So we're helping to lower that too by improving their social connections. So a lot of opportunity here. While there's tons of tools that we can leverage for clients to boost mental health, one of my favorite for any client is the Wheel of Life. This can help to really gain a visual representation of their current life balance and set goals for improving in specific areas. So this can really highlight what's most important to the client, see where they devote their time, see where they're currently spending their energy, and then look for harmony or discord in alignment of values and actions. Another tool, life mapping, excuse me, involves creating a visual representation of one's past, present, and desired future. So this tool is really awesome for helping clients reflect on their life experiences, identify patterns or limiting beliefs that can be affecting their mental health, and then envision a more fulfilling and purposeful future. It can be particularly effective in addressing the challenges associated with masculinity and societal expectations and really helping them redefine their goals and values in alignment with who they truly are and their true selves. Of course, self-care is crucial for mental health and well-being, regardless of gender. However, male clients may have unique barriers or resistance to engaging in self-care practices. As a coach, we can help them explore and redefine self-care in a way that feels authentic and comfortable for them. Encourage them to identify activities that promote relaxation, that promote stress reduction, that are self-nurturing, such as exercise, hobbies, spending time with loved ones, or engaging in creative outlets. Meditation can also be a valuable tool for managing stress. It can improve focus, enhance overall mental well-being, but some men may initially be resistant to the idea of meditation due to misconceptions about it being too soft or being woo-woo. As a coach, we can absolutely introduce meditation in a way that aligns with their interests and values. So for example, you can present it as a performance enhancing technique or a tool for mental clarity and resilience, really highlighting the science-backed benefits it can have on their personal and professional life. And lastly, but certainly not least, encourage them in building a care team that can provide the necessary support, whether that's therapists, healthcare providers, mentors, or trusted friends and family members. Emphasize the importance of open communication and reaching out for help when needed. And really, through our words and through our actions, normalize the idea that seeking support is a sign of strength rather than weakness. So time for another case study. Mark here is a 40-year-old man who has a history of engaging in risky behaviors as coping mechanisms for his mental health challenges. He has struggled with substance abuse, excessive work hours, and impulsive decision-making. Mark's risky behavior patterns have negatively impacted his physical and emotional well-being, strained his relationships, and hindered his personal growth. That's a lot, right? Like, we just want to pause and take that in. I think first, as a coach, I would really want to understand his history of risky behaviors as coping mechanisms. There's a lot of curiosity that we could have around this. I'd really be curious to explore about any underlying mental health challenges that have led him to engage in those behaviors, and particularly if he has worked with a clinician or a mental health professional in the past or is currently. It's really important to address and understand the root cause of his struggles to be able to provide effective support. And we might need another member of the care team if he doesn't already work with a mental health professional. Helping him develop healthier coping mechanisms and strategies for personal growth would be really impactful. I do think it's worth pausing here to remember our scope of practice. So while we can help Mark move forward and set goals to improve his healthy behaviors, if there is something underlying there that is causing him to engage in those risky behaviors, and maybe there's some trauma in his past, another member of our care team is really, really essential. Coaching tools, we could leverage things like focusing on self-reflection, on behavior change, and of course, building resilience could all be really beneficial. One big tool that comes to mind is journaling. This could really help Mark gain insights into thoughts, his emotions, maybe even journaling some of those triggers for risky behavior. Encouraging him to explore patterns and identify alternative, healthier ways to cope with his mental health challenges can lead to those long-term positive changes. Another valuable coaching tool could be reframing negative thought patterns and impulsive decision-making. By helping him recognize and then change those thought processes, he can build more constructive coping strategies. We can also ask Mark open-ended questions to encourage self-reflection and self-awareness. For example, assuming that he used the language of a coping mechanism, we could ask something like, what do you think are the underlying reasons for engaging in risky behaviors as coping mechanisms? This could prompt him to explore the root causes and gain insight into his own motivations. We could also use affirmations or phrases that promote self-compassion and motivation, such as, you have the strength and resilience to make positive changes in your life. When was the time you made a positive change, and what helped you succeed then? Overall, we could encourage Mark to explore healthier coping mechanisms and foster personal growth, as well as helping Mark identify if another member of the care team might be helpful. And finally, let's explore hormonal and sexual health. While women experience more noticeable hormonal changes due to menstruation, pregnancy, and menopause, men's hormonal shifts are perceived as more subtle over time. A man's testosterone levels decline on average about 1.6% a year after the age of 40. But most older men still have testosterone levels well within the normal range, with only an estimated 10% to 25% having levels considered to be medically low. Now, this decline can contribute to various symptoms, things like decreased energy, reduced muscle mass, sexual dysfunction, sleep, and mood changes. These symptoms are often milder and more gradual compared to the hormonal changes experienced by women during menopause. But many men who have low testosterone levels experience no symptoms at all. However, lower testosterone, as well as other mental and physical health challenges, can result in things like a low libido, erectile dysfunction, and increased, difficult to manage feelings of frustration and irritability. In addition, prostate cancer becomes a concern as men age. It's the most common cancer among men, except for skin cancer. An estimated 1.4 million men were diagnosed worldwide with prostate cancer in 2020. Let's talk about testosterone. We hear about it all the time, but what exactly is it? It's an important hormone in men that serves several crucial functions. One of its primary roles is maintaining bone density and muscle strength. Adequate levels of testosterone help keep bones strong and healthy, reducing the risk of conditions like osteoporosis and promoting overall physical strength. Testosterone also plays a role in determining hair growth patterns and distribution, as well as influencing the distribution of body fat, typically leading to a more lean and muscular physique. Another significant function of testosterone is its involvement in the production of sperm. Testosterone is necessary for the development and maturation of sperm cells, which is essential, of course, for male fertility. Testosterone plays a vital role in maintaining a healthy sex drive and supporting erectile function. Furthermore, testosterone is involved in the production of red blood cells, which of course carry oxygen throughout the body. Very important function there. Sufficient testosterone levels are necessary for that production of red blood cells, ensuring proper oxygenation and maintaining overall energy levels. It can have a positive effect on mood and well-being, with optimal levels being associated with increased energy, motion, and improved mood. Now, on the other side of that coin, low testosterone can lead to various health risks and complications. In terms of fertility, low testosterone levels can contribute to reduced sperm production and infertility, increased risk of developing an enlarged prostate, which can lead to difficulties with urination. Low T has also been linked to an increased risk of blood clots, sleep problems, cholesterol imbalances, and potential worsening of heart failure symptoms. Some men, of course, we talked about with low testosterone, it's a mouthful, do not have any symptoms at all. Others can experience symptoms like we went backwards. Let's catch up. There we go. Like a low sex drive. So while this could be caused by lots of other things like stress or physical health issues, it could be a symptom of low T, erectile dysfunction, a low sperm count, sleep problems such as insomnia. And again, as we're going through this list, you're going to notice that these could be attributed to lots of other health concerns as well. That's why it's really important that they have these conversations with their physician, who's going to be able to order additional tests to see if it is low testosterone. Also a decrease in muscle size or strength, bone loss, increase in body fat, depression, and trouble concentrating. Again, when we look at this list, I look at it and go, gosh, this could be symptoms of a lot of different things. And of course, we know as health coaches, we don't diagnose, we don't prescribe anything. These are just some things to be aware of. And if you have a client who's mentioning a lot of things, we might have an educational resource we can pass over to them that may prompt a conversation with their physician about it. Now, prostate health is another concern for men, particularly those over the age of 40. The prostate gland is a small walnut-sized gland that forms a part of the male reproductive system. It's located below the bladder, in front of the rectum, and it plays a vital role in the production of semen. The prostate gland contributes to the composition of semen by producing a fluid that helps nourish and transport it. Despite its small size, the prostate gland plays a significant role in male reproductive function, and it's important for reproductive health, urinary function, and overall quality of life. But as men age, it can cause problems. It starts to grow, and that causes a whole range of issues. It's called benign prostatic hyperplasia, BPH for short, also known as an enlarged prostate. It's a common condition that affects a significant number of men as they age. Matter of fact, about 8 out of every 10 men will eventually develop an enlarged prostate at some point in their lives. The prevalence of BPH increases with age, with around 90% of men over the age of 85 experiencing this condition. While BPH affects a large portion of the male population, not all men will find their symptoms bothersome. However, around 30% of men will experience symptoms that significantly impact their daily lives and their overall well-being. Now, the symptoms of an enlarged prostate can vary, but typically involve urinary difficulties. One common symptom is the feeling that the bladder does not completely empty after urination, which leads to a persistent sense of incomplete voiding. Men with BPH may also experience a sudden and urgent need to urinate without the sensation of a gradual buildup. So it's that it just hits you all of a sudden. Additionally, the flow of urine may start and stop multiple times during urination, and some individuals may need to strain to initiate or maintain a steady flow. Managing the symptoms of an enlarged prostate is essential to improve quality of life. As you can imagine, these symptoms alone could disrupt sleep. They could disrupt social encounters. They could cause a lot of stress. Not only do they have those physical symptoms, but then they can also manifest in all kinds of other challenges. And of course, unfortunately, it could progress into prostate cancer. So some risk factors for prostate cancer include things like age. The risk of prostate cancer increases as men age, especially after age 50. So around 60% of prostate cancers are diagnosed in people who are 65 or older. Another risk factor is race. Black men in the United States and other men of African ancestry are diagnosed with prostate cancer more than men of other races. Black men are also more likely to die from prostate cancer than white men. Being of a Northern American or Northern European location, for some reason here, I'm sure there's lots of reasons we could dive into, but studies show that prostate cancer occurs most often in North America and Northern Europe. It also appears that prostate cancer is increasing among Asian people living in urbanized environments. Think places like Hong Kong or North American and European cities, particularly among those who have a lifestyle with less physical activity and a less healthy diet. And of course, family history. Prostate cancer that runs in a family called familial prostate cancer makes up about 20% of all prostate cancers. This type of prostate cancer develops because of a combination of shared genes and shared environmental or lifestyle factors. Now, symptoms of prostate cancer can be quite an exhaustive list, but some of the most common ones are frequent urination, weak or interrupted urine flow, or the need to strain to empty the bladder, the urge to urinate frequently at night. Again, this is where that interrupted sleep comes in. It really can impact their ability to feel rested, which then can impact their entire day, right? I know when I don't sleep well, I'm definitely a different person. So I can imagine night after night, if your sleep is interrupted, how that could really affect you. Blood in the urine, a new onset of erectile dysfunction. There could also be pain or burning during urination. Now, this is much less common, but could still be a sign. And then discomfort or pain when sitting. And this is caused by that enlarged prostate putting pressure on the surrounding structures. So what coaching tools could we use with patients with prostate or hormonal health concerns? Again, education is always a great place to start. Providing educational resources and information can help the client to understand their condition better. This can include explaining the disease or the concern, treatment options, potential side effects, and available support services. Again, it's really important to rest in your scope here. We don't want to give them individualized medical advice. We don't want to assume anything their doctor may have told them. We really want to ask them what information their doctor gave them. If they, say they have they're a patient with prostate cancer and they've been diagnosed and they come and they're talking to you and they say, my doctor didn't give me anything. We can always work with them to feel empowered to go back to their doctor's office and ask for that information. We can leverage information. There's a ton of prostate cancer resources and services on the internet that we could refer them to that even have support groups. So again, the education is more about supplying resources versus us being the authority. We know that we are not the authority on medical conditions. So really that piece too is about empowering the client to make those informed decisions about their health and treatment, right? So just remember, I say it over and over again, scope, scope, scope. Don't give advice, just simply provide reputable resources for the client and then hold that conversation about what pieces they understand, what pieces they don't, and where they might need to get that additional information to fill in those gaps. Of course, encouraging the development of healthy lifestyle goals can support overall well-being and potentially improve any treatment outcomes. It can also lower risk factors and prediagnoses. Emotional support. A prostate cancer diagnosis or experiencing symptoms related to hormonal health can be really emotional challenging. Offering emotional support and creating that safe space for the client to express their feelings and concerns can be really valuable. Providing empathy, active listening, these things that coaches are so great at, and really working with clients on those coping strategies can help them navigate the emotional aspects of their journey. Of course, prostate cancer or low testosterone and its side effects can have a significant impact on self-esteem and on confidence. Engaging in activities that boost self-confidence and enhance the self-image can be really beneficial. This could include things like identifying and pursuing hobbies, engaging in social support networks, or exploring personal development activities. Setting goals and creating a vision for the future can really provide a sense of motivation and a sense of purpose. By helping the client envision a positive outcome and what they want to achieve, they can maintain focus and work towards their desired outcomes. And of course, assisting with medical referrals and preparing for doctor's visits can be instrumental in ensuring the client feels empowered in their wellness journey, and also make sure that they feel to receive and get the necessary medical attention and follow throughs with their treatment plan that they need. So let's take a look at our final case study. Robert is a 60-year-old male client who has recently been diagnosed with prostate cancer. He's feeling overwhelmed and anxious about the diagnosis, treatment options, and the potential impact on his overall well-being. John seeks the support of a health coach to guide him through his prostate cancer journey, provide emotional support, and help him make informed decisions about his health. Whew. He's got a lot going on. It's totally understandable that he's feeling overwhelmed and anxious. We could definitely chat about his emotional well-being, the need for information and education about prostate cancer and what to expect with his treatment. We could chat about his support system. It's really important to give space to address and chat about his fears, his uncertainties, any concerns he may have about his diagnosis and treatment. Additionally, we could assess his current lifestyle and support system to help him determine the resources available to him as he navigates through his prostate cancer journey. Also, we could pull in some of those coaching tools that we've talked about. Again, education is really a big piece of the puzzle to providing him with accurate information about prostate cancer, the treatment options, the potential side effects, just knowing what to expect and what is, quote, normal, although we could definitely argue there is nothing normal about a cancer diagnosis or journey, but just knowing a little bit of what to expect can be really empowering. We could also leverage a lot of emotional support, right? Just simply being there. Sometimes the best thing that you can do is listen. So being there, active listening, empathetic communication, providing that safe space for him to really express his concerns, chat through what may be worrying him, what's leading to overwhelm, giving that safe space for him to be a little bit vulnerable can really help to alleviate anxiety and provide reassurance. Just knowing you're not alone going through those things. I know on a personal note, my father-in-law had prostate cancer, and while he was going through his treatments, one of the things that he had said, and I feel like he is a very emotionally intelligent person, but he said, man, I just really feel alone. Like, I don't want to bring this to my family and talk to them about it, which he was, because he knew that he needed that. But he said, it's really tough because I'm supposed to be the father. I'm supposed to be the provider. I'm supposed to be the tough guy. I'm supposed to be the one who takes care of everything for my family. And right now I feel weak. I feel like I need help and I can't do this on my own. And that's a really difficult thing to express. And if it's really difficult to express for someone who is really emotionally intelligent and is really in touch with their emotional side, I can only imagine how difficult that would be for somebody who hasn't reached that place in their emotional wellness. So just being able to sit alongside them and open and have that safe space where they feel like they don't have to be the strong person for you, they can come and bring their true self, I think is really, really impactful. And again, we could even work on goal setting and vision exercises if he wanted to really help him maintain his focus and give him some motivation during his treatment and kind of that other thing to focus on. We could also, of course, tying into that piece about support, help him identify support networks. So whether that is family and friends or an outside support group that focuses on maybe prostate cancer survivors or others through that journey, can really provide him with valuable emotional support and those shared experiences. So potential questions that maybe we could use with Robert are things like, how are you feeling since receiving this diagnosis? This can really open the floor up and give him an opportunity to express how he's feeling. We may ask, what specific information or concerns do you have about prostate cancer and its treatment? Let's figure out what he knows or maybe what he doesn't know or what he's worried about in the future. Are there any lifestyle changes you would like to make to support your overall well-being and treatment? This can kind of start leading us towards goals and to keep moving forward. Questions and phrases that really aim to open up that dialogue to understand Robert's perspective and, of course, provide him with that necessary support and guidance throughout his prostate care journey can be really impactful ways that we can walk alongside him as his coach. And finally, we have to acknowledge that most health coaches are female. We certainly have some wonderful male counterparts in this industry, but the majority of us at this point are still female. So with that, we can sometimes feel a little ill-equipped to tackle men's health issues. I want to pause right there and assure you this is absolutely not the case. And as a matter of fact, when we did the women's health webinar 2 months ago, men can be a wonderful resource for women as well. Women can be a resource for men. We're all human at the end of the day. But if you find that imposter syndrome creeping in, here's a few tips maybe to boost your confidence or little reminders. And again, sometimes we did a webinar on imposter syndrome quite a while back, but it's really great. It's on our YouTube channel if you want it. I feel like I've said that a lot, but there's so much good content on there. But you can put little sticky notes around your monitor or have affirmations that you read before a session. So if you find yourself being one of those female coaches who struggles when thinking about tackling men's health issues, hopefully this webinar has helped you to feel a little bit more confident, but also lead into those affirmations. First, remember, be educated and open. Engage in ongoing education and professional development related to men's health issues. This can involve attending workshops or seminars, webinars like this one, even online courses focused on men's health, or seek supervision or mentorship from experienced coaches who have expertise in this area. Just stay informed about current research and best practices in men's health. Remember, you don't have to be an expert in men's health. You have to be an expert in coaching and walking alongside someone. So emphasize shared knowledge and skills. Foundational knowledge and coaching skills are applicable across genders. While there may be some specific considerations for men's health, such as prostate or testosterone-related issues, a solid understanding of basic human physiology, behavior change, and coaching techniques can still be effectively applied to support male clients. Have open and honest conversations with male clients about their specific concerns and needs. By actively listening and demonstrating empathy, we can gain valuable insight into their experiences and tailor their coaching approach accordingly. Building that trusting relationship and creating a safe space for all clients, regardless of gender, to share their health concerns is essential. We can also develop a network of healthcare professionals, including doctors, urologists, or psychologists that specialize in men's health. Collaboration with those professionals can provide that comprehensive support to support male clients and ensure that they receive appropriate medical guidance when necessary. Empathy and cultural sensitivity. This is just solid advice for any of us when we work with clients, but it's really essential when we're working with clients from diverse backgrounds. While gender differences do exist, focusing on understanding and addressing individual experiences, individual concerns, and those individual beliefs will help us to support any client, much as our male clients, more effectively. And of course, seek support and feedback. Engaging in mentorship can provide valuable insights, guidance, and feedback to further enhance our coaching skills and effectiveness, and also, in turn, boost our confidence in working with diverse populations, or in this case, with our male clients. So with that, here are 3 key takeaways from our deep dive into men's health. Number 1, men's health needs attention as that longevity gap continues to widen. We need to talk about it more. It's something that we don't talk about enough. It's been in the shadows. We need to bring it out into the light, and we need to talk about it so that we can help reverse some of these negative trends. Also, social and cultural expectations can play a large role in men's health. We talked a whole lot about the stigma, about some of that masculine personality that sometimes men feel like they have to embody. And we've got a lot of work to do on that. And of course, regardless of all of those things, and because of all of those things, health coaches are primed to walk alongside men in their wellness journey. We have all of the skills and all of the tools needed to support men in creating positive behavior change. And we can be there with them every single step of the way. And as we wrap up our presentation, I just want to personally extend an invitation for you to join our coaching community if you are not part of it yet. We have a ton, so many helpful resources available to help you manage your coaching practice. Everything from our dynamic practice management platform to the coaches resource library folder. And that has some of the tools that we mentioned here in the webinar, such as the Wheel of Life and Decisional Balance. Also has some referral resources which you can use to support your clients. At YourCoach, we're so passionate about the health coaching revolution, and we would be thrilled to have you on the platform. Of course, you can access it through the App Store, through Google Play, or any web browser at yourcoach.health. We also just released a deep dive into men's health that you can find on our website. Every 2 weeks, we release these amazing deep dives that go, as you would suggest from the title, really deep into a topic. And so we just released one on men's health. It's a culmination of a lot of different studies and information. It's beautifully laid out, very easily digestible. You can find those right on our website as well if you would like more information into a particular topic. Like I said, men's health was just released recently, so you can check that one out. Also, if you registered for a CEU ticket, keep an eye on your email inbox over the next 24 hours for a link to the quiz. We're going to drop that survey here in the chat that we talked about in the beginning of the webinar for feedback about our webinars. If you wouldn't mind taking a moment to fill it out. We really want these to be an impactful use of your time, to be something that adds to your coaching practice, boosts your confidence, gives you new skills to use. So if you wouldn't mind taking just a quick moment, it's 6 very simple, very fast questions, and it's filled out anonymously. So if you wouldn't mind just taking a moment, I would appreciate it oh so much. We really appreciate your presence here today. Of course, I hope to see you on the platform soon. Have a wonderful day, everyone. And thank you so much.